Hello and welcome to Understanding Food Insecurity. This training is a collaborative effort between Community Action Partnership, Hunger Free Lancaster County, and the Central Pennsylvania Food Bank.
The contributors of this training are listed on the slide here. My name is Laura Whitaker Escobar, and I'll be one of your guides for the short training today.
And my name is Megan Zook, and I will also be helping with this training today. So let's get started. In today's training, we will cover the following topics. We will define food insecurity, discuss federal programs aimed to assist with food insecurity, talk about how the charitable food functions, and we will also discuss current food insecurity data with a focus on Lancaster County, Pennsylvania. What is food insecurity? There are two types. One is called low food security, and the other very low food security. The difference between these two types is displayed with a visual on the slide. For individuals and households with low food security, there is usually enough food to cover most meals during the day, but the meals are possibly the same foods over and over again, there is not a lot of variety or desirability, and there is a reduced quality of food. The example here shows that for breakfast, lunch, and dinner, there are ramen noodles. Ramen noodles, while delicious, are not something you would want to eat for every meal of the day. Very low food security is even more extreme. Not only does the definition of low food security apply here, but this type of food insecurity lacks quantity of food. So the example here is just one meal of ramen noodles a day and not much else. In this experience, individuals are much more likely to skip meals or have reduced intake.
What are some of the surrounding issues with food insecurity? For food insecurity, it is difficult to determine the exact cause, but other factors that often go hand in hand with food insecurity are listed on the slide. There are also many others. These are just a few examples. The effects of food insecurity are many. We only have 4 on this slide. Of course, physical and mental health are affected by food insecurity. Someone's not getting a variety of nutrients that their body needs, or they're lacking food variety and quantity. That's going to lead to nutritional related health conditions such as heart disease, diabetes, among other things. Not having enough food is stressful and may cause trauma. We'll get into this in following training. Additionally, being hungry can lead to difficulty focusing and performing in areas of life, important aspects such as school, work, attention to children. And finally, food insecurity is something that can take a lot of time that is not spent in other important life tasks, such as taking care of home, children, work, and school.
We wanted to briefly pause and show these two pyramids. The one on the left is Maslow's hierarchy of needs, and the one on the right was made by Ellen Satter, who is a registered dietitian. Maslow's theory here is that before people can start experiencing things like safety, love, self-esteem, and self-actualization, they first need to have all of their needs met. This includes food, shelter, clothing, and sleep. Ellen takes it a step further to say that not only is having enough food sufficient, but everyone should have acceptable, reliable, delicious food that has variety and supports their well-being.
This slide speaks for itself. 1 in 8 Americans are food insecure at some level, and experiences with food insecurity vary greatly by race, ethnicity, and household type. For example, Black and Hispanic households are more likely to experience food insecurity, and so are families with children. When discussing food insecurity, it is important to address some common myths about individuals who are food insecure. Many of these come from images from media or assumptions about individuals using services. Myth number 1 assumes the image of a typical food pantry visitor as someone who is homeless or unemployed. And while this is the case for many folks, data shows that most individuals visiting food pantries are working adults, or households with at least 1 working adult, and many with 2. So this actually speaks to the gap in wages and costs to them. Myth number 2 is a common one that tells us while we may have thought that elderly people were the most food insecure individuals, that is not true. Elderly individuals have the lowest rates of food insecurity types compared to other households, like households with kids, adult-only households, single-parent households, and so on. Lastly, something we hear very commonly is that people who go to food pantries don't actually need the food and are abusing the system. But research from the Central Pennsylvania Food Bank's Impact and Policy team shows that individuals visit food pantries when they need the assistance. The data shows that 50% of individuals who visit food pantries in Lancaster are still experiencing very low food security too. So folks who are visiting food pantries to take care of their needs, and these resources exist for them to do just that. So there's no abusing the system here. Food assistance is one of the most available forms of economic assistance today. When folks are able to get help with food at food pantries or with other programs, they can shift their finances to other important areas and costs, such as rent and utilities, medical bills and prescriptions, clothing and personal items, car repairs, and all sorts of seasonal bills. So these next slides will be used to explain basics about federal programs aimed to reduce food insecurity. This slide right here is about the SNAP program, Supplemental Nutrition Assistance Program. This program used to be referred to as food stamps, but now it involves an EBT card that can be used with most retailers to purchase food. Households that are eligible for SNAP must have incomes at or below 200% of the federal poverty line. So for example, a household of 2 is eligible if they make $40,000 or less a year. According to research across various food pantries in Lancaster County, 50% of food pantry visitors are receiving SNAP benefits, and those benefits last just about 2 weeks for folks in Lancaster County. SNAP is a very effective program, especially because it supports the local economy. Not only that, but for every 1 meal that a food pantry provides, the SNAP program provides 9 meals. Women, Infants, and Children, or WIC, is another electronic card food benefit that is federally funded. The WIC program provides nutritious foods to supplement diets, information on healthy eating, and referrals to healthcare. This program also uses an EBT card and can be used at participating retailers to purchase specific types of foods like fruits and vegetables. The difference between SNAP and WIC is that WIC targets children and their caregivers during very important developmental years to ensure that nutritional needs are met.
So we unfortunately don't have time to cover these other federal programs, but a quick Google search can tell you more if you're curious. You can also go to fns.usda.gov and read up on all the other federal food and nutrition service programs. Just a quick note that the Central Pennsylvania Food Bank and many food pantries also run these programs.
So next we'll tell you about the Charitable Food Network. This slide shows a visual of how the network functions. Food banks have territories that can span many counties in the state. The Central PA Food Bank has 27 counties that it serves across Pennsylvania. CPFB's job is to procure food at a discounted rate or free rate and distribute it to partner agencies. What is a partner agency? Well, it is anyone who is committed to serving the community with the food that the food bank has received. These can be food pantries, operating in churches, community centers, and nonprofits. And we're also seeing more partner agencies come from hospitals, set up places for patients to shop and take food home. Partner agencies come in many forms. The final step in this process is the food going to neighbors who are eligible for it. Currently, households at or below 185% of the federal poverty guideline are eligible to receive food from a food pantry. One more note about this slide here. Food for partner agencies doesn't need to solely come from the food bank. Partner agencies often need additional food, so they run food drives and partner with local grocers and growers to take food donations that aren't being sold in stores or at markets.
You may be wondering how food banks and partner agencies are able to get so much food for neighbors and how they pay for that food. Surely it can't all be for free. There are 2 big federal programs that many food banks and partner agencies in the Charitable Food Program participate in. One is called the Emergency Food Assistance Program, or TFAP, and the other is called the State Food Purchase Program, or SFPP. TFAP is a program that provides some funding and food to states. The food is USDA and 100% American grown. The funding is for administrative needs to coordinate TFAP food distribution. SFPP is additional funding that states can use to procure food for partner agencies. It is also funding that is passed on to partner agencies so they can purchase foods at reduced rates. These funding and food sources are very important to food banks and pantries to be able to afford to carry out their programming and feed neighbors.
With all these federal programs in place and the charitable food system operating the way it is, haven't we solved food insecurity yet? Food insecurity is still very high in our communities and among the folks who utilize our services. And 50% of food pantry visitors in Lancaster are still experiencing very low food security. And among these folks, only 47% of them are utilizing SNAP. So what can we do to help?
There's many things we can do to help. This training and the others we have created will share ways to improve food pantry services so more people have access to food. Some things to help from the content that we learned in this training are that SNAP and WIC are powerhouse programs that provide a lot of food support to households. You can promote these programs at your food pantry site to help more people get enrolled. Also, we will be spending much more time in the trainings to come discussing the many other ways to improve pantry services so people feel more comfortable coming to you for food and so they receive food that they need for their families. Thank you for your time today, and we hope you gained some helpful information about food insecurity in your community.